So with that, I'm going to hand over to Darrell Gale, who is the Director of Health in East Sussex. Thank you.
Thank you very much. This is going to be a bit of an interesting session because I've not got a screen here to look at my own slides. So I'm going to keep sort of looking up and working out where I am. And the reason why I'm going to do that is it's a slideshow on the whole. It is not lots of slides with lots of statistics that you might expect from a Director of Public Health. Caroline's just done some statistics, which is lovely to hear from our MP. But generally, I'm just going to talk through some themes and illustrate them, hopefully rapidly, because I think I've got about 20 minutes to do this and I've got about 50 slides. So it's going to be quite rapid fire. So let's see if it works. Yeah, title, Transport and the Public's Health. Here we go. So define. First thing, set the definition. So what is transport? Transport's a system for taking people and goods from one place to another. What is health? This is the World Health Organization's description of health. So it's nothing to do with services or medicine. It's a state of complete physical, mental, social well-being, not merely the absence of disease or infirmity. So it's a positive state, and marrying a positive state of health with transport is the focus of my presentation. And we start off with the positives for health. So the first one is about the economic benefits. So with transport, you get jobs, you get services, you get businesses, you get the economy. These are really, really important for health as well. In my annual Director of Public Health report this year, the focus is on last year's was on jobs and the economy, because without jobs and the economy, you don't have the ability to maintain good health. Access to healthcare. So healthcare is important, and having a transport system that means you can get to see doctors, get to hospital appointments, etc., is really important. This delay is going to be annoying. Access for healthcare to get to you. So things like air ambulances and ambulances, rapid systems to take you to hospital if required. And the ability to get to large regional hospitals, as we now have in Brighton, where we know treatment is always safer in big centres where you've got concentrated specialties. But everyone always says, how do I get there? How do I get there? And the most important thing is that the NHS has the transport system. Oh, we're going forward. A lot of modes of travel still mean, particularly rail commuting, that you have to walk, and you have to quite often walk briskly and a lot of distance to get to the station, to get from the station to connecting services. So built into many of our transport systems is a lot of physical activity. Bringing people together. Transport is great for getting you to meet with people, getting you to visit families, allowing families to spread out across the country, to meet with friends, etc. And ultimately freedom. Without transport, without being able to move from one place to another, we don't really have as much freedom in our lives. And I bet if you go back 200 years and look at the geographic areas where people would have moved around and where their families would have been and what would have been their local area, it would be tiny compared with today. So that freedom is a real positive for mental and emotional health. But there are negatives for health, and a rather lot more negatives of transport for health as positives. So this is Ellie Kissy Deborah. Sadly, this 9-year-old child who's walked to school, was alongside the South Circular Road in London, died from chronic asthma, and the coroner and the death certificate actually now state that her cause of death was air pollution from transport. Moving on to someone else's slides, because they couldn't be here to talk about air quality. So this comes from the CMO's annual report of last year. And this is looking at the health effects of air pollution throughout the life course. And think particularly of pregnancy and children, because you're going to live a long life with some of these impacts on you. So the impact of asthma, the impact of developmental problems, atherosclerosis, low birth weight, the impact of that throughout your life. And that comes from air quality, air pollution. And then, of course, you think of the vulnerable at the other end, the problems for older people of the air pollution as well. And these are the contributions to particulate matters. And you can see the urban contribution there in 2012 and 2030, the projection under current government policies. And whilst you see there's a very, very welcome reduction, that still doesn't get us to the 2021 recommendation of the WHO. And it's the red, the urban contribution, that includes the transport elements, the road transport and rail transport, etc. This is the particulate matter and nitrous oxide emissions from vehicle sources. So you do really see, again, a very welcome decline in those. But as that previous slide said, we still have a problem if in 2030 we're not getting to get to somewhere where we should have been in 2021. The contribution, 50% of the nitrous oxide comes from road transport. And when you break that down, you see a huge amount of that coming from diesel cars and other diesel vehicles. So actually moving to petrol or moving to electric is a really important part of taking that huge half of local road transport out. But we can't just think about private cars as well. We obviously have to think about lorries and public transport as well, because they've got a really important part to play in that as well. CMO has produced a number of recommendations. First one is electrification of vehicles, and this potentially could pose a problem for some specific forms of transport, particularly things like refrigerated vehicles. Oh, this is not moved on. Yep, heavy vehicles and specialised vehicles. So the electrification may not be the solution for every vehicle type, but clearly for private transport, that's a major part of the recommendations. Electrification of the railways, well, most of our railways in the southeast are electrified, but we do have one diesel service in Eastbourne that takes us through the Marshalink to Ashford via Hastings, and we do have a partially, almost totally enclosed station at Eastbourne Terminus. So again, the diesel fumes there are contributing to poor air quality, and we have to think about how that line is electrified and hopefully made high speed as well, so it actually brings some further economic benefits to the area. National government, local working all together to reduce air pollution, and active travel is clearly part of that, and that's not just for transport planners, that's for town planners to involve in as well. So we start designing communities to be far more easy to negotiate by active travel, walking and cycling. So back to my slides. So the negative impacts of travel, of course, road traffic accidents. This is a plaque that marks the spot of the first collision of a car. We know that cyclists and pedestrians particularly are far more vulnerable users of the road system, and this is a ghost bike that's put in places where a cyclist has sadly been killed to signify what's happened at that place. Got the design of cars and the design of our transport. So if you think of some of our big SUVs that we're driving, and you think about how many people you can get in that spot where you can't see, the blind spots are shocking on a lot of new vehicles. So they might tell you how safe they are to drive with all your NCAP stuff for the driver's safety, but if you've got big bars, if you've got a bonnet that's this high, if you've got a massive four-wheel drive car, and you can't see children if they step out in front of you, then we have a serious problem for health. So you can see there, our rate of killed and seriously injured in East Sussex is higher than the national average. We also design environments for vehicles. This is in Hastings, but this road is quite a new road in the Churchwood area of Hollington. And you can see the pedestrian path. Well, the pedestrian path, it actually has some lights, but it takes you away from the road. It takes you into dark, damp woodland. Do people use it? No, of course they don't. They either don't go anywhere or they drive, because that really isn't an accessible and attractive and safe feeling pedestrian route. We also, again, this is an example for Hastings, which is where I took a number of the slides. You end up with car-bound neighbourhoods, places that are full of places to park your car and nowhere for children to play, nowhere for people to delineate that humans should be coming first, and that the human scale of this sort of environment is really designed out, because this is built at car scale. Everything around this environment is built for the car, for maximum parking and turning circles for cars, not for humans. You end up with problems about noise. Noise pollution is a real problem for health because it keeps people awake at night. It stops them, therefore, keeping jobs if they're tired all the time. It has a major impact on people's mental and physical health. This is a new road scheme in Littlehampton, close to where I live in West Sussex. And the solution here is a 3-metre high corten steel fence that absolutely completely takes light out of people's houses. The Great Wall of Littlehampton, this has become known as. So that's there to prevent the noise, but it also prevents a huge lot of other positives such as views, sunlight, etc. Light pollution, again, the interruption of sleep patterns by lights from roads and from transport is a real problem for health. Obesity, not just the lack of physical activity, but we've got a real new issue in the last few years of rubbish food being delivered by people. So they get less exercise getting to their food because they sit at home and order online. Someone delivers it to them, quite often using powered transport, quite often using noisy transport, mopeds, etc., polluting transport, and the people get not just the rubbish food, but also the lack of exercise that goes with that. And you see this more and more, particularly in the poorest areas. So this is a market that is essentially driven by people's socioeconomic status and delivering what they think is convenient to those, but actually what is trapping those poorer people in poor health, in poor physical activity, and in poorer diet. And you see there the rate of overweight and obese people in East Sussex has been increasing, as it has slightly nationally, but obviously we've got smaller numbers, so ours is moving around a fair amount year from year, but is still not going in the right direction. Here are some of the risk factors again for obesity and some of the issues. This is from our joint strategic needs assessment. The point of this slide is to point you to that joint strategic needs assessment, because if you were expecting data, statistics, and a lot more graphs in my presentation, that is actually where you'll find them. And that is a site that brings together all health data and all social determinants data in one place. And it's accessible for yourselves. It's not there just for professionals to use. It's there for residents of East Sussex to use, and to use to argue back to power with data, with the solutions that you want to. So that's a fully accessible site, and that's my quick plug for it. Transport creates barriers, and sometimes, as the example of the Hampden Park level crossing, it creates barriers to other forms of transport as well. And when you've got barriers, it means that you can't get across. It means that people can't bring together as easy as we said in the positives. It creates barriers between communities, it creates barriers for economies, and ultimately it starts to sort of drive out and engineer out human scale activities. If you've got to cross busy highways, busy railways, certain ways, it might mean that you've got to sort of go miles out of your way to get over a bridge, etc. So essentially, a lot of our transport is creating environments where it's a lot easier to be lonely and to have fewer connections than it is to be as connected as we'd like. And of course, we end up with barriers that kind of pen us in. You know, these are quite hostile environments very often. This is from the highway code, so this is an example. But very often, and obviously Eastbourne Town Centre is an example where a lot of this type of engineering has been taken out. But there are many parts of our road systems where, if you're like me, you're a bit of a professional jaywalker, you encounter these things and you never use them. You cross elsewhere because you don't want to be sort of told where to go. If you're going from A to B, you can see where you're going. You kind of want to walk that route. So these environments really aren't naturally enable us to see where we're going as humans and to walk in the way that we'd like to. So this slide just brings together a lot of those determinants of how motorised transport are affecting negatively on health. But we have other things. Transport helped bring in COVID. It's a vector of disease. So now we have so much international air transport, we get infectious diseases far more rapidly than we would have done in the past. When a pandemic's going to happen, it's going to happen. But COVID came in so much quicker because we had air travel, and you bringing in the disease before it's even detectable, even before it's determined and defined from the source. And I shall now mention climate change, but others are covering climate change. But we know that transport systems have a negative impact on climate change. And if it's bad for climate change, it's going to be bad for health. And that's absolutely clear in things like warming, heat waves, flooding, that those have massive long-term impacts on health. Not just a critical risk of death, but a long-term risk, and particularly things like flooding, a really long-term mental health negative impact. So some of the solutions and some of the things that have happened, thinking about some of the changes. Well, I touched on COVID, and this is still clicking through. Yeah, changes in working patterns, working from home, overnight, something that people have talked about for years. Wouldn't it be great to do more working from home? We've got the technology that enables us to do it. Oh, our bosses won't let us do it. We had to move to that. And a lot of it, a huge proportion of it has stuck. Far more people working from home. They're not doing the commute. They're not using their cars. They're not using some of the public transport. That can create some problems because public transport needs users. It needs the income to keep a universal service in operation. So we've had a kind of injury to some of the good things there. We also had some real positives about taking a huge number of private vehicles off the road. And you can see here, this is the proportion of people in East Sussex mainly working from home. You can see, Eastbourne, it's more towards the Meads area, but you suddenly see, Wadhurst is the prime place, it seems, in the county to be working from home. Solutions, we've moved away from sort of big 1960s vehicle-focused engineering solution. This is from the Buchan report on transport from, I think, 1964, talking about segregating. Yeah, we have to segregate pedestrians from vehicles. Vehicles have to move unheeded at high speeds, underneath, over the top, etc. And we know the type of environments that led to, subways for people, bridges for people, really horrible concrete, buildings and environments for people. And as like me, people start thinking, well, I want to go from here to here. I'm just going to jump over this barrier and walk through. Weren't entirely safe when you've got a sort of 6-lane dual carriageway to cross on the way to the shops. The proposal at the time from East Sussex County Council for the Lewes bypass. It wasn't a bypass at all. It was a dual carriageway running straight through the centre of the historic town. Of course, this never happened. This is the model. This is in the East Sussex Archives down at the Keep near Brighton University. It's absolutely fascinating to see that and look at it with absolute horror of what could have happened. But that was the design solution at the time. That was the thinking at the time. Keep traffic away from people, make it fast, through routes, bypasses, wide roads, keep people away from it, and keep the vehicles moving at pace. Solutions, there is no magic money tree. I think that's not my expression, someone else came up with that. But we don't have in the public sector or the private sector the money to do all the things that everyone wants. Yet we've got to find ways of making adaptations to our environments and to our streets to make them more humane and to mitigate against all those negative impacts of traffic and transport, and particularly private road transport. So it's a step-by-step process. Quite literally, it's about active travel, so it's about walking and cycling more. And again, I'm telling you things that you already know, and because there are far more experts in the room around active travel and around green planning policies. I'm not pretending to be an expert on this, but I want to remind us all that this is important. And some of it isn't new either. Some of it we've known for a long time, such as 20-minute neighbourhoods or 15-minute neighbourhoods. Yeah, a planning idea that has been around since Ebenezer Howard started talking about garden cities in 1898. Yet it's been dusted off and given a new name and some new focus. And all these things I think are really important. And we would think, yeah, we'd love to live, and many of us already do live in places where you can walk to get a pint of milk, to get access to cultural activities, sporting activities, educational activities, to get a lot of your shopping within 15 or 20 minutes walk of your home. And yet, it's suddenly become a political thing. It's suddenly become a control thing. I don't think Ebenezer Howard would have said he was sort of forcibly controlling people, but you've suddenly got something that's gone wrong in our society where people are campaigning against something that is so clearly good sense and for good health and well-being. And of course, 20-minute neighbours are nothing new in counties like East Sussex. Again, just go back. That's Wadhurst, named last year by the Sunday Times as the best place in the country to live. It's a 15-20-minute walking neighbourhood. It's a market town. It's a village. And in Eastbourne, a lot of the town is actually made up into smaller areas with their own facilities, with their own schools and facilities, a group of villages together. And that is a 15-minute neighbourhood. And it kind of happened naturally. We didn't need a scheme or a campaign to tell us that that was a good way of living. Yet in some ways, we've kind of forgotten some of the aspects of that. Some of the aspects that we need places to meet. This is Portland in Oregon, who've done a lot of work around social connectivity in their streets by having benches and small gardens at the corner of streets. They've got very much a gridiron pattern in the city of residential streets, but they recognise that they were the type of things that where you have a junction, that's where people naturally bump into each other. And so by putting benches there, by putting some landscape in there, that actually encouraged people to spend even more time together and break down some of the isolation that you get, particularly in car-driven sort of American cities. But this is the type of thing, I think, again, in our environments, as we're greening our environments, as we're thinking about active travel, having places to rest and having places to kind of catch up with people will be really important. Making sure that your transport systems can work together. I cycle. I quite often cycle into work at County Hall, but at the end of the day, it's getting dark, it's getting cold. I'm very, very tired. I don't want to cycle all the way back to Arundel, so I want to take my bike on the train. Yet Southern's bike policy mean I have to wait technically till 7 o'clock to do that, which I don't because most other people don't. But policies that work against bringing modes together aren't helpful. They're not helpful for health. They're not helpful for choice. And they're exactly the type of policies that drive people to think, it's easier and quicker to drive. This is somewhere in the Netherlands. This is a Woonerf. This is a scheme of sort of greening residential areas, making them far less car-driven than that example in Hastings. And you can see there the human scale. You've still got places to park cars, but you've got green environment, you've got pedestrians or cyclists going right down the middle. They've got the priority. Again, nothing new here. These have been in place for about sort of 40, 50 years in some places. You've got our examples here in London of trying to get more play streets, trying to reduce rat running. Hopefully those trees and some of the greening will go up to the levels of the Dutch example. But some of this again has been movements against this, people moving some of the barriers, destroying the planters, destroying the environment so that they can drive through. And I think this is my final slide. There's nothing really new to this in the UK either. This is back in the 1990s in McNally terraces in Leeds. Inner city terraces are back-to-backs. They had enough of people rat running through their roads. So they clubbed together, bought some turf and turfed over the street one weekend and had a party. And then this got support of the city councils after a few years. They started doing more of it permanently. I've not been up there probably since the 90s, but I was in Leeds earlier in the week and just looking at the transformation of the city centre there, where you used to have nose-to-tail traffic at rush hour. You've now got wider pavements, two-way cycle routes, bus lanes, and virtually no private transport at all, and far, far easier and far more pleasant to walk around. So we know the solutions. Some of them are solutions that are in the past, but we've got to find a way without that magic money tree of making some of these things incrementally, step by step, happen in our towns and places. Thank you very much.
Thank you, Darrell. We've now got Scarlett McNally, who's going to come and talk to us. Thank you. Scarlett is the orthopaedic surgeon for Deputy Director for the Centre of Peri-Operative Care and Bespoke. Sorry.
Perfect. So hopefully, where do I have to point this to? There we go, just be slow. So hello, it's so lovely to see people here. I've been an Eastbourne resident for 22 years. I work at the DGH and I've got various other things. I'm going to talk very, very fast. I have no conflicts of interest. The only people that pay me any money is East Sussex Healthcare NHS Trust. I've got a column in the BMJ, and I donate that to the Medical Women's Federation, where I'm currently president. I've been involved in various things. The UK Health Alliance on Climate Change has been going for about 15 years. It's organisations that are trying to get health better. This is kind of past me. I'm still operating. I'm working half-time now, which is lovely. It's the best job in the world. I use that picture because I do a lot of talk on diversity. That kid's now first year at uni. So I was pregnant when I was operating, and I was on the Council of the Royal College of Surgeons for 10 years. It's now again much more diverse, but we did a lot of stuff behind the scenes. So I'm trying to tell you I'm very, very important because it's not always completely obvious. So I put this slide up when what's the most dangerous activity you can do? Anyone? Because this is what I do all the time. You break it, I'll fix it. I love it. It's great. Tell me, anybody? Thank you. Thank you. You've seen these before. Sitting down is the most dangerous thing you can possibly do. Being sedentary, it's absolutely lethal. So cars, computers, all that stuff. Smoking is the other one I would accept. And basically, you think it's genetics, it's not. 20% of ill health is caused by genetics. So, you know, your granny lived till 90, actually, you're not protected, mate. And actually, the biggest cause, I'm going to go back one. I'm going to try and go back one. There we go, thank you. This is the deprivation indices. So you're 2.5 times more likely to get heart disease, which is the light green, or cancer if you're in the most deprived area than the least deprived area. And that's completely unfair. And you can see it's a dose-dependent curve. This isn't just some random aberration. This is what causes people to be ill. Nothing about me fixing it or just giving the tablets. This is what ill health is. And what actually causes it, you can talk about poverty and, oh, it's really difficult to fix, we haven't got any money, blah, blah, blah. But actually, what causes it in the human beings, why you move a kid from one postcode to another postcode, what makes them different? It's smoking, nutrition, physical inactivity, alcohol, and pollution. Those are the biggest ones. Yeah. And those are the ones where actually you need to think about working and improving people's lives and stuff. So I was lead author for this, representing the Royal College of Surgeons of England, but I led on it for the Academy of Medical Royal Colleges. It's all the medical Royal Colleges and Royal College of Nursing and Faculty of Public Health. You can still get it. The best copies on scarlettmcnally.co.uk because it's kind of carefully hidden on the academic, because it was 2015. We weren't talking about physical activity then, but now we do a lot. And this, feel free, get your phones out, take pictures. It's none of it's copyrighted. If you do exercise at a dose of 150 minutes a week, you reduce your risk of dementia by 30%, 30%. Why isn't everybody doing it? You know, stroke, 30%, all these things, type 2 diabetes, depression. Why aren't we doing this? If this was a tablet, everyone would take it, wouldn't they? So the middle column is, does it treat it? Because we talk about primary prevention. Everyone thinks, oh yeah, that's for later. But actually, it treats those conditions. If you've got type 2 diabetes, you're less likely to get kidney failure if you do your exercise. Yeah? So that is the treatment. It's the tertiary prevention. It's the getting people better when they've started to have something, that teachable moment often. And the lifetime risk, just to show you, those are really, really common conditions. Yeah. And it's not me saying that. It's all this is stuff out before 2015. National Institute for Health and Clinical Excellence, Public Health, everybody says it, but no one actually does it. So this is your chance to do it. And this is from the Global Burden of Disease in the Lancet. This is for the UK. You can see I've circled physical inactivity and low physical activity, the fourth leading cause of disability adjusted life years. Yeah, so you can get it. All the other ones are things like diet low in vegetables, drug use, all that stuff. So and this is how many conditions people have. All those conditions we talked about that are really, really common. 1 in 4, the Richmond group, I was at their launch last week. 1 in 4 adults in the UK have multiple conditions, 2 or more conditions. This is the age going up that way. I've put the line in age 65. You can always think of someone age 65, yeah? So this is no conditions in blue, and gradually you get more and more. It should really be 3D and social deprivation as well, but 50% of people at the age of 65 have multiple conditions, and this is what is costing the NHS loads of money and all your taxes, because it goes up and up and up with age. So exercise is great, yeah, because the best bit about it is just getting up off your sofa and having a bit of a wiggle reduces your risk. So the reduction in risk, and we talked about reducing 30%, that's reducing from 1 to 0.7, yeah. So this is the amount you do in intensity and time Met hours per week, just getting up and doing something massively reduces your risk. So we need to get people that are doing nothing, doing something, going for a walk, climbing stairs, getting on a bike, just getting us something. And it has, there we go. It has a different effect on different things. There's the breast cancer one, it's a bit slower effect. So again, this is a slightly different scale. I put the arrow at 150 minutes a week of moderate activity. And that reduces your risk of different things at different stages. So these are, you know, you want a graph, you get graphs. It's there's loads of them out there like that. This works, but the critical thing is we need to tackle the people doing nothing, not tackle, you know, lift, be nice, support. Because 1/4 of UK adults do, this is no exercise at all. That's less than 30 minutes a week. You know, not the lot, us lot all doing 150 minutes a week, God, we're so smart, but this, and 47% of over 65s do no exercise per week. We need to get people out and doing stuff. And sedentary is bad, exercise is good. You can have the slides later for all this stuff, but basically it's not just, you know, burning off the calories. It has a metabolic effect, which is why it manages blood sugar and type 2 diabetes and stuff. It has an inflammatory effect, which is why it reduces the recurrence of cancer. It has and if your legs are strong, you can get to the toilet and you don't need social care so much, yeah, and you can get out of your hospital as a day case. This is from, anyone see the Chief Medical Officer's report last week that came out? So this is Chris Whitty. So this is the map, and the dark blue is the percentage of when you've got areas with 25% of the population aged 75 years or older. So that's 20 years away. Yeah, that's a lot, a quarter of the population. So we can't possibly have people being as inactive as they are because we simply can't afford it. And this is, again, he's got that curve the other way up. Just doing a bit improves the health benefits massively, yeah? And it tails off. After an hour a day, you're a bit weird, to be honest. Active travel, it's 250 pages or something, but the active travel bit, if you just Control F and put in travel, enables older adults to embed it into their day. This is what we need to create the places, terrain of walking past so they don't trip because they're scared. I sit there and fracture going, oh, tripped over the pavement. I don't think I'll sue, doctor. It's like, you know, but yeah, we'll sort you. Do you know what I mean? It's kind of, they're scared to go out, and we need to change that. Being physically active throughout the life course delays the onset of health. I wrote this in 2017, saying if we can get people to be active, it will reduce the need for social care. Because if you can get to the toilet yourself, you don't need to pay for a living carer or to go into a residential home. And I thought everyone would be great. That's great. We can prevent the need for social care. We're each projected to need 10 years of social care on average. Obviously, none of us are average. It's in the socially deprived groups. And of course, no one read it. No one did anything about it. But it's there. It's on my website, scarlett.co.uk. And you can think about that curve. If you stay active, you don't dip below the line where you need care or where you have an illness that then makes you worse. So we need to keep everybody staying above the line. And again, Chief Medical Officer said this is life expectancy, but it's not just that people in the 10% most deprived areas have a shorter life. It's that they spend 26 years of it in poor health, whereas in other areas, it's only 15 years. And that is the bit, just to be callous, that's the bit we're all paying for that was unnecessary. Yeah? So to do change, we all think we're amazing, we're going to do everything. Anyone have New Year's resolutions ever? Yeah, stick to them. Bit difficult because we're so busy with our things. We need to know the stories. We need to know data. And Darrell Gale's showed lots of things. But we also need the how. We need the practicalities. So I've got waterproof trousers in the pannier of my bike outside. I cycle to work. If it's raining, put the trousers on. Not a biggie. Yet we need to make everything so it's not a biggie. We need the practicalities. And we need the NHS to lead on this. And it's basically, we all know about the dopamine hit when you do something nice. This is the orthopedic surgeon's guide to brain chemistry. This is why we do anything. Yeah? But we need to do it together. If you sign up for a charity run, charity walk, you say you're going to cycle to work on Fridays or whatever, you will do it if you stick to it, if it's in your regular thing, because we need that, we need the mini rewards and stuff. And if you do it together, if you do a good deed, you actually get that buzz from the oxytocin. Your endorphins take 20 minutes to work, so I tell my patients to have running shoes by the front door. So they actually get out because you've got to get over that inertia. And here's some numbers. Feel free to take pictures. 62% of UK adults say it's too dangerous to cycle. Only 3.5% of walking journeys are over 2 miles. So it's difficult. If you're trying to get that modal shift, you need to get the cycling and the buses and the trains or whatever, because people don't walk the long distances. And 34% of children are driven to school by car. Free and generous parking availability quadruples the chance of driving to work. There's all there. And people who cycle to work, 40% reduction in cancer and in heart disease. Again, this is from the World Health Organization, because we just said what would make the world healthier? It's diet and physical activity. So they've said these are the things to do. Active travel, space for recreation, walking and cycling, commuting. It's duh. I'm just saying this is not complicated. This is from the chief medical officer, the previous chief medical officer's guidance on 150 minutes for all adults. You're not exempt. I've put up the infographic for people with disabilities. They should be aiming for the 150 minutes. So we need to keep the swimming pools open and all that stuff so people can get out, do stuff. And for frail older adults, the sit to stand exercise, walking up and down stairs, walking around the block, anything, just to keep your heart and lungs going, and some strength and balance training. This is from the British Medical Association. I've been hassling them. I was on a couple of committees there in the past, trying to get them to relaunch it. But anyway, the best forms of exercise, they fit into everyday life. You need it in that habit. You need it as just what you do. When it's November and it's, too wet to go play football, you just cycle to work, These are electric bikes are amazing. The evidence is coming out now that people are just as fit with an electric cycle because they convert more car journeys to it. That was measured. That was for 10,000 participants, that first reference. Those are my 2 bikes I had at the time. You just plug them in like your phone. You just charge them. It's not difficult. And if people who loan, so any of you running businesses, loan electric bikes, you save the money in the sick leave because people are so much fitter and they love it. And you arrive at work when the endorphin hits you, which is the natural opiates, and you just feel calm, and it's lovely. The benefits to health outweigh the risk by 10 to 1. People talk about pollution, they worry about collisions, but actually 10 times the benefit. Pollution we've talked about, it's not just asthma, it's cancer, and it's poor cognition means dementia. Yeah? And the pollution is a significant problem. And it's not just what comes out of the tailpipe, it's the particulate pollution from the brake and tyre wears. It causes about half the damage. They're tiny little particles, and they get between the cells in your lungs, go straight in and have a very nasty inflammatory effect, which is probably the effect on the cancers. This is from the old Joint Strategic Needs Assessment, but I'm just saying East Sussex is an outlier for being bad for people getting killed and injured on the road. It's often children at start and finish of the day, and the action suggested at introducing 20-mile-an-hour areas. We don't necessarily need the I'll keep talking. So this is what I'm working with the Centre for Perioperative Care. They pay the East Sussex Healthcare NHS Trust for half a day of a week of my time. We can reduce complications. 10 to 15% of operations will have a complication, even if you think you're brilliant. 4 times higher if people are physically inactive, 5 times higher if they're frail. We're working on trying to get the population healthier in these long waiting lists so that we can get people to be day cases, which are much more efficient, and so they don't have complications, which keeps them in hospital. We've been working with Macmillan, prehabilitation of people having cancer treatment. They get through it better, fitter, better, sooner, teachable moment. This is from the Lancet on if people are doing exercising, getting outside, just fresh air, just green therapy, blue therapy. It's a thing. It really exists. It's in the Lancet. It's not. These are couple of things I've written. It's about sustainability because there are lots of operations that didn't need to happen. Some people with knee arthritis would be better doing some controlled exercise and wouldn't need a knee replacement. All those consumables that go in and all that sort of thing, and the complications that then need back to operation in intensive care, all that stuff, we can reduce the risk. So yeah, win-win for sustainability. It's like, how many numbers do you want? It's all there. This is from the Centre for Perioperative Care. It's largely funded by the Royal College of Anaesthetists, cpoc.org.uk. Amazing stuff on there. 50% reduction in complications if we can get people to do stuff before their operation. Saves, loads of money. And so basically we can either do this because it's nice, because we're nice people. We want people to have a nice life and lovely, interact with other humans, and it's great. Or because we absolutely cannot afford it. We can't afford what's coming. I'm a doctor. I'm lucky. But we've got 6 million carers in the UK. Half the East Sussex Healthcare NHS revenue budget goes on adults. We can't afford this. This is about the little grey dots are 1% of people's, as it were, and the area on the curve is the amount of money. 45% of hospital spend is on 3% of patients. Yeah? So those are the people who it matters for everybody. Nobody's beyond. This is from the East Sussex, the revenue budget for East Sussex County Council. That's our council tax, people. Half of it on adult social care. And 27.7% of people in this county are working in education, public administration, health or social care. And everyone's working very hard, and it's impossible, and people are under amazing stress, and there's burnout and all that stuff. But if the population wasn't so inactive and unhealthy, you wouldn't need quite so many social care workers. Just floating that to you, because I'm a nice person. I do it because I think people need to know it. Collisions. This is collisions of pedestrians hit by cars. 142 in 5 years. Just imagine those knock on the door, those families affected, the school, just horrible. Yeah. And it's only 5 miles across. It's easily cyclable or bus. This is what East Sussex is planning to do with the pedestrianisation. I just warn you that those areas in pink that currently have motor traffic would be far better with a two-way cycle lane, so that people can permeate between, so you can go through slightly quieter roads. If that's all pedestrianised, no one's going to make that modal shift if they're pushed onto the busy ring road. You need to have those, the pink bit should be two-way cycle lanes. I'm begging you. This is from the, thank you. This is a report from which Bespoke and the Eastbourne Chamber of Commerce both contributed an independent report about what to do about the seafront. You see those parked cars where the promenade's narrow, it's suggesting two-way segregated cycle route instead of those parked cars for that section where it's narrow. Yeah? And that would work. What else solution is there? This is an independent report. It's on the Bespoke website. This is, like I said, I've got a column in the BMJ. This is from that. You can access it. In Edinburgh, when they introduced 20 miles an hour limits across the town, road traffic casualties, that's people injured in any kind of collision, reduced by 40%. Because the traffic's moving slower, so the injuries aren't so horrible. But here we got the funding all wrong. People petitioned for something, a pedestrian crossing outside their school. It goes on the list of 79, and only the top 3 have funding. So yeah, all of these angles, exercise, pollution, all that stuff. What can you do today as a car driver? Give that 1.5 meters. I wasn't sure if I was going to do it, but I'm just going to do that. This is 1.5 meters, yeah? It's in the highway code. If your wheel is there and you're overtaking me and my wheel is there, that's the distance. If you cannot do it, don't overtake, you hang back, you look like a muppet. Oh, why are you driving slowly, mummy? You look like a muppet, but you allow that might be wobbling on their first bit to being active. Yeah, that's what 1.5 meters means, 5 foot. Yeah, and they're allowed to drive in the centre. They're a vehicle. They're allowed to ride in the road. People don't know that, so we need to. This is from Salisbury. Have a loan scheme. They're great. This is me. I was actually horribly ill about 5 years ago. There's still a video on YouTube somewhere, and I had myeloma, which is cancer of the plasma cells. My heart was constricted by all this floating around stuff. I couldn't walk up 3 stairs. That's why I got so good on Twitter at Scarlett McNally. 3 stairs, play on phone, 3 stairs. Got an electric bike to get out to do it because I was told I wasn't fit enough for stem cell transplant. Got fit for stem cell transplant, and I'm back at work part time. Yeah, this is what we need, people. So it's a personal story, but stories make change. Yeah, this is my final slide. Thank you very much.
Thank you, Scarlett. As I said, my job's chair to try and keep everybody on time, so I'm failing at that terribly. But I think that the health is the background for everything that we're trying to do today. Some short-term investment in our local transport system will have long-term effects, not only for the local government, but for central government as well. So with that, moving on to Lisa Simmons and John Wheeler.